Okay, I think we're gonna start now. I know some people are still joining, but we're just gonna start off with like a little bit of introduction and things like that. So today we're just gonna be going through some general advice and tips for the Queen Mary interviews, which are coming up quite soon actually. But like just giving you a general idea of what the interview structure is gonna be like, and then we're gonna go into a bit of some interview question examples, and there'll be a chance for some people to get involved as well and try answering some of them themselves. So one sec. So just to like introduce myself, my name is Amna. I'm a first year dental student at Barts at the moment. So I'm commuting into university because I live in London. And just like in general, how I found it so far, it's going quite smoothly at the moment because uh I don't know if some people have done some research into it, but they've like refined their curriculum for our year. So it's been like a little bit of changes going on. So we're just like working with it at the moment and just going with the flow. Um, we've done a little bit of clinical work, but not too much. It doesn't go too crazy in first year, but it's so far it's been going fun. Um, myself, I've been and other people in this call have been working with MyUCAT to run some mock interviews as well. So if you are interested in running a Queen Mary specific mock interview or any other university as well, please do get in touch. I'm just going to give a moment for someone else to introduce themselves, as there's another dental student in this call as well.
Hi guys, my name's Ekene. I'm a dental student as well. I'm currently at Manchester, but I'm just here to support this talk and just give you guys the feedback on some of your answers. But yeah, I'm also part of the MyUCAT team, so I'm looking forward to meet some of you guys hopefully soon.
Okay, perfect. So if you guys have any questions throughout, just save them for the end and then we're gonna answer give you a chance to ask them as well. But if anyone is interested in booking a mock interview, where you can get one-on-one advice, please do get in touch afterwards. So just to go through the general Queen Mary interview style, it is a panel interview and they hold it online through a
Oh,
Teams call. Through a Microsoft Teams call just like this. It's roughly 20 to 25 minutes long in total because at the start they do like a little briefing with the student ambassador where you just get your mic checked out and just like calm your nerves a little bit before starting. And then you have a roughly 20-minute session with the actual interviewer. Usually there's two separate interviewers inside the call and they like have a mix of who's asking which questions. Usually, I'm assuming quite a few of you have got access to your article already, the one that you get 2 weeks before your interview, but I'm assuming some people don't as well because they hold them in February as well. Um, but in the first 10 minutes of the interview, they do ask the article related questions. So just things like summarize the article, tell me your thoughts on this, things like that. And then in the second half of the interview, they ask your typical normal dental school interview questions, like seeing your motivations for dentistry, seeing if you've got enough knowledge on your hot topics, things like that. Normally questions that you've probably been preparing quite well up till now, seeing as the interviews are quite close to coming up now. So just to get into the like main topics for today, um, the main point of this session was to help you understand how to answer a question like this. So why, if they ask you, why do you want to study at Barts? Or why do you want to study at Queen Mary's? Out of all universities, because there's so many out there in the UK. So I'm gonna start off by giving like a model answer or like my point of view of this question, some sort of answer that I would have given to this in my interview. So I'm just going to start off with that. So this is like as if I've just been asked the question by the interviewers. So one of the main reasons I decided to apply to Queen Mary was because of the range of opportunities they have in terms of societies and events that they hold. One of the main ones was that drew me to the university was Teddy Bear Hospital, which is a society that gives dental students the opportunity to go into the community and interact with young children, giving them oral health advice and tips on their like general health care. Now, this really intrigued me because it mixed my own interests of volunteering and giving back to the community alongside actually contributing to dentistry as a whole by giving preventative advice. It aligns with my own personal interests at the moment because I'm very active in my own community, as I do volunteering at a local care home at the moment. So this kind of opportunity really intrigues me because it will give me a chance to continue with my own personal interest at university, rather than just leaving it over here at this point in my life. Another thing that really drew me to the university was the fact that they've got a newly reformed curriculum. Um, Speaking to dental students and carrying out some research, I found out that this new curriculum has allowed students to gain earlier clinical exposure from previous years. Now, this is something that really was intriguing to me because it meant that I would be able to put myself in situations earlier on where I'm dealing with patients and really putting my practical skills into play. I think this would be really beneficial in my like ability to practice dentistry and communicate with patients because it would allow me to have a longer range of experience and it would really bridge the gap between classroom setting style work and actually dealing with real life patients in a clinical setting. And one final thing I'd like to add is that from my talks with students at the university, something that really resounded through every single conversation I had was people's admiration of the student support services at the university. I've heard that they're very proactive with the events that they hold and with like general like tips and advice that they give out for students. Now, I understand that dentistry is a really mentally tolling degree, and I would need a support system in place for me when I'm actually studying it and when I'm actually in the career. So the fact that this university has a really good student support system in place for me, it makes me really confident that I'm going to be able to get through the journey of university, as this is a really important factor to think about when I'm choosing what university to apply to. So, just to summarize, some of the main features about each university that I was looking into that really stood out about Queen Mary was the range of opportunities they had, especially in terms of volunteering. The fact that they have quite early clinical interaction, which will really enrich my learning experience. And just to round it off, the student support system and the student support services really did interest me and really make me confident that I'm going to be able to get through the degree and make the most out of it. So I know I said a lot just then. There's quite a few points I just went through, but this is just roughly how much time you would actually get to answer this question. Usually, people have a lot of ideas for this kind of question, like the location, um, the what style of teaching the university has, the cohort sizes. There's all sorts you could answer for this one. But just for me personally, these three things like really genuinely did draw me to the university, and I did mention them in my actual interview. So these are things that you could recycle in your answers, or if you have any questions, you can ask about them. And try to get in touch with students at the university. Try to see what they actually enjoy about that university. Why did they pick it over other unis? Because that's the most genuine piece of advice you can get, rather than just going online and reading the actual uni's website where they're going to be just advertising themselves. So do speak to people in real life as much as you can. So just finishing off just that part of this session, this is my model answer. That was my model answer for why Barts or White Queen Mary. If anyone has any questions, we will get back to them at the end. I can't see the chat at the moment, but I can see it's popping up a bit. Um, People are asking, do we all get the same article? I think everyone does get the same article, but you're gonna get it at different points in time. So, but they tried to equalize it by giving it to everyone exactly 2 weeks before their interview. So some people might already have access to it now, and then other people are gonna get it later on. But they do use the same article for everyone. So to finish off that last bit. Now we're going to have an opportunity for you guys to get involved. So I'm assuming you guys have practiced these kind of questions quite a bit up till now for your interviews. We've got an example question here. Describe the importance of confidentiality in dentistry. So if anyone wants to have a go at this and be brave, you're going to get some feedback from both of us afterwards. So do take on this opportunity. If anyone wants to have a go, please just like do the hand raising button. Or you guys can just someone just unmute yourself if you're ready to go have a go.
Hi,
Hi.
can you hear me?
Yeah.
Could I have a go at answering it?
Yeah, sure, go for it.
Should I just start?
Yeah.
So, I think confidentiality in dentistry is really important because it also links to the GDC's principles of maintain like confidentiality and maintaining like each patient's privacy. And I think it's a part. It also links to professionalism as a dentist, and you need to be professional and hold yourself in a way where you can protect each patient's privacy. It's also important because they might not consent to giving their data out to other people, and yeah, I don't really know what else to say.
Okay, well done. That was a really good try. I really liked how you brought the GGC into it because that's one of like the key buzzwords they want to hear in this kind of answer. You talked about the patient privacy as well and professionalism, just as like a point of what you could do better next time, maybe. Try to expand a little bit more about the point to do with the patient privacy. Why is that actually important? Like, how does that impact the patient's point of view or how they're going to feel if their privacy is compromised? You need to just expand on that point a little bit more. But I'm gonna you can get some more feedback in 1 second, yeah?
So like to expand on that feedback, you need to, like she said, expand, and you can give an example. Okay, so if you were talking about confidentiality, you could say that one thing, like you listed a lot of things, but just go point by point. So one point could be that can help build trust, and then you can say, for example, my work experience, or, like give an example that you've seen, right? Or give an example how, like you don't need to be an example that you've seen, but in the dental practice. So maybe if a patient opens up to the dentist is important that the dentist keeps it to themselves, right? It doesn't just spill it out, right? And that builds trust with the dentist. And why trust is important is because when you have that good patient dentist relationship and there's trust, right? They're going to keep going, right? So that's when you can link it to beneficence because if this is going to encourage patients to keep coming, right, then they're going to keep seeing dental treatment. That's going to be good for their oral care. Okay, so that's one aspect one way you can look at it. So you need to try and say point and expand it and go to the next one.
Yeah. Perfect. So does anyone else want to have a go? I can see one person's raised their hand. If you just want to unmute yourself and then you can start.
Hi, hello. Can you hear me?
Yeah, hi.
Um, so whether like medicine or dentistry is equally as important because it's a rule that gives the patients like you guys said a sense of trust and also privacy. So they don't have that feeling, oh, I'm giving all my information away. It's more like I can trust a dentist. I can trust that um they'll keep um they won't just like share my information if I don't want to. Like I can consent to it if I want, or I don't have to. And obviously there are times when confidentiality has to be broken appropriately. So like for example, if let's say like a patient had like periodontitis, um and they were like, "Oh, oh, don't tell my partner, please," or they were like something. Yeah, if it said, "Don't tell my partner," and then in that kind of case, you might have to tell the partner just because it's quite important, and the partner could maybe help them, maybe take care of them as well.
Okay, just if you're done, just to go through the kind of points that you mentioned. Again, you touched on the like trust and privacy aspect, but I think that really does need to be expanded on a little bit more about how that directly impacts the patient. Like they're going to lose their trust in the dentist. What will that cause? It's going to cause them to not want to open up in appointments. It's going to mean that they're not going to tell them their symptoms. Maybe they won't like be comfortable taking on the treatment plan that the dentist is saying. It's going to make them lose their trust in them, and it's going to impact the quality of the care that they receive. In terms of the breach and confidentiality thing, I think that the example you chose isn't really the best one that you could have put in this question because you didn't really justify a proper example where it would be very, very necessary to tell your partner. So the patient's been diagnosed with a certain gum disease, and you said that it would be beneficial for the partner to know to help take care of the patient or something like that. I don't think this is a specific scenario where confidentiality would be needed to be breached, just because it's more on the basis of the like helping the patient cope with the treatment rather than someone's safety being in question. So maybe in that situation you could suggest to the patient or like strongly encourage them to seek support in other people. I will go through one or two scenarios where confidentiality could be breached or should be breached in the feedback that I give later on. So I'm not going to go too specific into that right now, but just to make sure you're listening for that part. Okay, do you want to give some feedback?
I think you covered everything for that answer there, yeah. But
Okay,
again, the key thing is expanding on your points, not just making a list of points. Say it's easy, the best structure to do is say a point, expand, go to your next point. You can, if you're going to list that out at the start, make sure that you go and cover all those points later. Okay. So, and a good way to do that is to try and think of some examples of different situations before your interview.
Okay, perfect. So I hope that advice was helpful. I think that we've got quite a bit of time still. So I'm going to give one more person a chance to answer that question if anyone's volunteering still. You can just unmute your mic.
Can you hear me?
Yeah?
I wanted to add on the trust and privacy part. Would it be
Sorry?
a good, I said I wanted to add on to the trust and privacy part where the
Yeah.
previous person was talking about it. Could you also add on how dentistry is more based on cumulative patient care? And once that trust between patient and dentist is broken, it's much harder for the patient to open up to the dentist. And in more severe cases, the patient could potentially switch dentists or switch whole clinics, depending on how badly they feel that their mental health has been violated in sorts. And like a different example could be if you go to an orthodontist and get Invisalign or braces, and the dentist wants to take pictures of like the before and after, and we haven't explicitly given consent, but they could post the pictures online, but they did still proceeded to. That could still have a negative impact on your mental health. As you can see, many people can see, I guess in a deteriorated state your teeth are in. They might put comments on there and breed insecurity in your mind.
Okay, perfect. I think that was really nicely expanded on. You gave a specific example as well. In terms of talking about the consequences of the patient's trust being lost, don't make switching dentists the main problem. Focus on the fact that they might not ever trust dentists again, maybe, or maybe whenever they do interact with a healthcare professional again, they won't fully open up to them, even if they aren't the one that caused them the breach of confidentiality in the first place. So don't say that switching a dentist is the main problem, okay? But
Okay.
other than that, it was a very good expansion.
Yeah, exactly. I mean, literally, is we don't care. I mean, yes, we care, but if they're going to keep going to the dentist, that's a good thing. If they switch dentists, they keep going to the dentist, that's a good thing. So yeah, exactly as you said. It's more about them not going back to dentistry, which is going to cause more harm to them, which is going directly against beneficence, which is doing the most for a patient.
Okay, perfect. So I did see one other person had their hand up. If you want to quickly answer the question, that's fine. Otherwise, we can move on to the feedback or like the model answer type thing. Did someone want to answer? Yeah? Okay, I'm going to let one more person do it.
Can you hear me fine?
Yeah.
Okay, so first of all, what confidentiality is it's respecting and protecting the patient's information. And the reason why it's so important in a career like dentistry is because when patients come to you, they have that expectation that their information will be kept privately. Certain patients may not want the population or other people of society to know their oral problems. And by spreading that as a dentist and breaking that confidentiality, that trust between the dentist and the patient could be lost. That patient may not come back to a dentist in the future, resulting in a negative impact to their oral care in the future, going against that medical ethic of non-maleficence, so do no harm. And also not just the trust between a dentist and a patient. Let's say if a dentist breached this confidentiality, if the wider society were then to find out about that, that can cause a really big issue in that population with that specific dental practice. It may result in loss of the whole society and that whole area within that one practice, going against that GDC pillar number 9, so maintaining trust within the profession. And overall, in the long term, if less patients come to dental clinics, we're going to get a population with worse in oral care overall.
Perfect, thank you. That was a very nice answer. I can see you incorporated some of the things that we've been saying in the feedback as well. You expanded on like the impact of losing trust as well. And I liked how you put two perspectives on it, on just the patient as an individual, but then also the wider community, because that's a very, very valid point. Especially in terms of like, on social media and stuff, when these kind of experiences are spread, it turns into a lot of misinformation as well. Like people distort things when they're spreading it around. And that's a very serious issue because then it can change a very big portion of society's view or perspective on dentistry. So that's a very, very good point to bring up. Well done. Do you want to add anything?
Sorry, I didn't realize I was unmuted. I would just say that you try and bring in maybe one more point if you can, just because of timing. It wasn't a very short answer, but it wasn't a long one. It wasn't up to the length. So it was really good, genuinely. But I would say try and get one more point in if you can.
Yeah.
Sorry, could I just quickly ask? Somebody
Yeah.
told me that, for the interview, apparently since it's so short, the question should be like 2 minutes. Or
Okay,
should
so
we?
with the Queen Mary one, it's quite different from other universities because they've got such a short amount of time to speak to you that what the interviewers tend to do is cut you off while you're talking, like on almost every single question. So just keep talking until you get cut off. Don't like round off your point, just continue talking until they cut you off. That's what I'd say for this university. It's very different when you sit an MMI interview because it would be really nice, like say you've got 5 minutes to answer. You'd start with the intro, what am I going to talk about? You'd say your main points, then round it off by summarizing. But with the Queen Mary one, because it's a panel and they do cut you off, just continue talking or like continue to adding more points until they do ask you to move on. Okay, I hope that answered your question. We're gonna move on to like the model answer type bit for this question now. So I'm just going to read it out. I've got like a few brief bullet points on the screen at the moment, but I put together an actual model answer and I'm going to read that out as we go through this. Okay, so just to repeat the question, why is confidentiality important in dentistry? Confidentiality is very important in dentistry as it is both an ethical and legal requirement. Respecting patient confidentiality is a GDC core principle as it helps build trust and rapport between the dentist and the patient, allowing patients to feel comfortable opening up about their symptoms and worries without any fear of their information being shared inappropriately. This trust is essential in putting the patient's interests first because it allows you to make accurate diagnosis and provide the highest standard of care possible. It is also the responsibility of a healthcare professional to decide which situations it is appropriate to break confidentiality. However, this should only be done in line with GDC guidelines and done only when it's necessary. For example, it could be required if a dentist believes a minor is at risk of abuse from a parent or caregiver, as they would then need to speak to colleagues working in social services to help resolve the issue. As well as this, you might encounter a situation where it is in the best interest and for the safety of the wider community to breach confidentiality. For instance, if a patient confides in the dentist about a potential criminal offence they are planning on carrying out, which will directly harm others. In summary, confidentiality is really important in dentistry to uphold trust between healthcare professionals and patients. However, I do recognize that there are some instances where confidentiality can be breached as long as it is in line with GDC guidelines. So I hope that model answer was beneficial for you guys and you got a better idea of understanding of the kind of points you'd need to include in this. Does anyone have any questions about that up till there?
Sorry, I'd like to ask, what do you mean by highest standard of care possible?
Okay, one sec. Let me just close this. Okay. What I mean by higher standard of care possible is because it's like those three points that go before it and the strain at the moment, kind of like tie that in together. So what I'm trying to say is that the whole idea of it breaking trust and rapport when you breach confidentiality, and the idea of putting your patient's interests first by allowing them to open up to you and feel safe with you and comfortable, it allows you to make a more accurate diagnosis, and it means that your patient is more confident in taking on your oral health advice and maybe implementing tips and tricks that you've told them. So once this happens and once they've gained that trust in you and they listen to you, it means that they can take on the highest standard of care possible. Because can you imagine if there's a situation where a patient comes into the clinic and they've had all sorts of stuff about people spreading information, private confidential information around in the community. And then when they hear this dentist is the one that they're about to see, they have like a prejudice just before they come into the room, and then they assume every single thing that they're saying is slightly wrong, or maybe they just think that Google is going to tell them something better than what the dentist is saying, just because they're not meeting that standard of professionalism that they should be. And this could mean that the patient isn't going to listen to the advice that the dentist is going to give. And you'd be surprised how many people out there genuinely just don't believe that dentists have the patient's interests at heart. So it does shake their trust in the dentist a lot. So that's what I meant by it impacting the standard of care that the patient's going to get. I hope that kind of answered what you were asking. I did waffle a bit, but that's basically what I meant by that statement. Is there any
Thank
other
you.
questions? Someone asked how many questions do they roughly ask for the 10 minutes part. So this really does depend on which interviewer you get, because there's quite a few different interviewers that the university does use. And it really depends on how much you've expanded on your answer, or how much, or like if they felt like they've heard enough from you. What happened in my interview was at the end, because they had asked everything they wanted to, they gave me like a minute to add on anything I wanted. So I just reinforced some of the points I mentioned earlier on. So that if you do get an opportunity to do that, definitely go for it. Maybe add on some points that you thought you could have expanded on a little bit more at the start of the interview. But in general, it does really range. Don't expect a certain amount of questions. I hope that answer was okay. I think we're going to move on to the next one now. But I'll give you more chances to ask questions afterwards as well. So here is the second question. Tell me about a time you displayed good communication skills. So again, I'm going to give some people a chance to answer the question. Maybe some people who haven't had a go already. Just unmute yourself and then you can go for it. Anyone want to have a go? No one? It doesn't need to be too complicated of an answer. You can pick a very basic example and then expand on it.
Yeah, guys, there's 40 of you in here, so I know that people can answer. Even if
Can
you
I,
spoke before, you can have a go.
can I have another go?
Yeah, of course.
Yeah.
So, a time where I've displayed good communication skills is when I'm in my school's chaplaincy team, where I was having my lunch break, and uh, a girl came in crying, and I could tell that she was like distressed, right? So I sat down with her, I sat aside with her, and I used active listening skills, and I had open body language, and like gentle eye contact, and I let her speak to me, and I spoke and gave her advice. And later on in the day, she came up to me and she thanked me for being able to like actively listen to her and like give her advice. And this is similar in dentistry. This is good in dentistry because in dentistry sometimes you're going to have like patients that um patients that are distressed, and you need to be able to communicate and empathize with them in order to calm them down and be able to like really I don't know, like empathize with them in a sense. Um, I saw this during my work experience as well, where I saw a patient that was a sickle cell patient that was doing extraction, and throughout this, I also saw it was four-handed dentistry between the nurse and the dentist, and this allowed for efficient workflow as well as the nurse communicating with the patient, where the patient was visibly like distressed, and because he was neurodivergent, the nurse was communicating clearly with him and um, like asked him if he needed the fan off or if he wanted the music to be louder. And I think it's really important in dentistry in order for one to have like an efficient workflow with your team, as well as for your patient to feel open to like communicate and speak to you.
Perfect, thank you. That was a very nicely structured answer. You were in terms of your like explanation of how you displayed good communication. That was really nice because what I often find when I'm listening to people's model answers is that when they saying that part of the answer, they turn it into more of like a storytelling thing, and then they don't expand on the skills they used in that context. They just said, I communicated like this, I communicated to the girl, something like that. But you were specific. You said you did active listening, you focused on having soft eye contact and open body language, and this was really good. It enriched your answer. So and then you've linked that to dentistry very smoothly as well. So this kind of answer would require you to have a section linking it to dentistry. And I think that was very nice because you highlighted quite a lot of different aspects of the patient's care system. Maybe to take it one step further, you could emphasize a little bit more on the like quality of treatment that the patient's going to get. So I know you talked about like the workflow being efficient and like the patient being comfortable, but maybe you could have expanded a bit more on the like actual healthcare service that the patient is getting, like in terms of how they're going to feel afterwards about their oral health. So just taking it one step further because we can always improve our answers. Do you want to add anything?
Yeah, so again, yeah, like you were saying, it was really good how you mentioned skills that you use. Active listening is better than just saying communicating. However, my first piece of advice is you might need to work on your speed of talking just slightly because sometimes it sounded like you didn't know what to say, so you paused and then kept speaking. So that will help you to fit everything in your answer. Because if they do cut you off and you don't get time to talk about maybe linking it to dentistry, then just answer still overall class as a bad answer, even if you were going to say it. But still, going on to your points, when you mentioned active listening, one thing you could do to be a bit better is say how you actively listen. Because now a lot of people are learning about active listening. You need to go a bit more, you don't need to, but it's helpful to go a bit more into detail about it. So you could say like, you active listen, because active listening is about not just listening to what they're saying, but other things about them. So you could say that you analyze how she was sitting, her eye contact directly with you, and that helped you respond. You could add to that, like, you could say active listening by doing this. My second point is, although you related it to dentistry, in this star structure, it's really important that you're reflecting on the skill of communication as well. So yeah, you relate it to dentistry, but what did you actually learn about communicating from this experience? So one thing you want to try and add is saying like, let's say this is a communication question. So you could say, I mean, this experience was really useful because it really taught me that communicating didn't just involve me just speaking to this girl, but also involved me having the skill to analyze how she was sitting, or eye contact, and then adapt my communication to her. And that's why I opened my body language a bit more. And overall, it showed an improved experience, right? You could say something else like communication, right? Like that's what you want to like. So I would do like you could even fit two of those in, then relate to dentistry, which is why your story has to be concise, which it was to be fair. Then go into your reflections and as you did well, relating it to dentistry. And I really liked your you gave like specific examples of what you saw. You weren't just vague about it. So that was really good.
Yeah, so just make sure you take on all this feedback because it's very like valid points that we're bringing up. It will just like take your answer to the next level, especially since at Queen Mary you will get a very short amount of time to speak. So just focus on making the like it a little bit quicker when you're talking and not leaving like long pauses. Um, who else wants to have a go? I can see someone's raised their hand that hasn't had a go already. Do you want to have a go? SA?
Yes, please.
Yeah, go for it.
So communication is the ability to impart knowledge or ideas into other people in a way that they can understand. And that is, it aligns with GDC principle number 2, where you need to be able to communicate effectively with your patients. The reason why communication is so important in dentistry is because dentists have to communicate with their dental nurse a lot of the time and also with their patients. And in addition to this, maybe they have to work with patients who are children or maybe have additional needs where you have to kind of communicate with them differently to how you'd communicate with someone else. Um, and there are two types of communication. So, there's like verbal communication, also non-verbal communication. So obviously verbal communication is the way that you're speaking, and non-verbal is, using hand gestures more, maintaining eye contact. So a time where I displayed good communication skills was when during my role at a tuition centre, where I was trying to explain division to a student in using a certain method that I like to teach. However, the student didn't quite understand it, so I had to be adaptable and show them a different method and teach that different method to them so that they could understand how to do long division, for example. And so that taught me that some people understand things differently and need different things to be explained to them. And this goes back to being relevant in dentistry, since you need to communicate treatment plans clearly so that patients can then consent to them as well.
Okay, well done. That was a very nicely worded answer. You went through quite a few different points. I liked how you included the GDC and you were very specific about having verbal and non-verbal communication, things like that. Um, the wording of the question, it was asking, tell me about a time you displayed good communication skills. It wasn't asking why is communication important in dentistry. So, like, in a sense, I feel like you should have started with your own experience first, especially since at Queen Mary they cut you off if you are taking too long with your answer. So please do try to start with the bit that the question is stemming from. So start talking about your tuition center with your adaptable communication, things like that, and then link it into dentistry. But like the actual content of your answer was very nice, and I liked how you were very specific. Just working on answer the question at least, like straight away.
But to expand on that, to be fair, the one thing I didn't like is the definition they did at the start. That's fine to do, okay. But yeah, as Anna was saying, you need to follow it's better to follow like the structure called STAR, like situation, task, action, result, reflection. Okay. So because this is saying tell me about time. So when you hear tell me about time, you need to go straight into that. So like yeah, it's fine to say a definition, right? Then go into your story. And I liked your story, okay, because you gave like a specific example. However, what they want to see, like you said about long division, like, but you said, oh, and I showed them a new method, right? You should tell the interviewer what method you taught them. So you could have said, so instead of just speaking it, saying my method to them, I instead drew it out and I used I don't know, maybe it's a bus stop method. Like, be specific. Like that makes the interview, because these interviews they could have been here for the whole day. They want to hear like these. They want to hear like a engaging story like that. So be specific with that. So I would say that would elevate your story. It's just a little tweak, a bit more. And then because of how you structured your answer, it was a bit disjointed because you spoke about why it's important in dentistry, and then at the end you then tried to do it again. But because that, I would say the ending of an answer is also really important. So it made it sound like you didn't really do much of it. At the end, your ending was or if you just said one little link, right? When you could have said a whole chunk of it together. And again, it's the same advice of also say, if you have time, say, talk about how this experience really taught you something about communication. Okay. So maybe it taught you that communicating is not just following one strict method, but it's about trying new things. Just like with the student, you first of all you try to just explain it with words and then use your hands and use physical descriptions to make it easier to them. And this relates to dentistry because in a dental practice, you're not just working with similar individuals, but every person's different. Every person and their teeth is a different canvas. And with children, for example, I may not only have to communicate, right, with I may not only have to communicate by speaking to them, I may have to show them the different techniques. This is something I saw in my work experience and something that like I've taken on. Again, that was just put up on the spot, but you see what I did there? Like you need to try and link it to communication as well and just work on the structure. And that would, but it was still good. Like the stuff you said was really good. Structure wise, that's what let you down a little bit.
Yeah, basically like aligning with what I said as well with this whole structuring. That's like the main thing you need to work on. But other than that, amazing answer. Who wants to go next? You can just unmute and go for it.
Could I try my answer again? I know I've already answered one, but
Yeah, you can go for it.
okay. So the time that I showed really good communication was during my volunteering at a care home. So at this care home, I have the responsibility to helping elderly people who have different levels of cognitive ability. And one specific time, what happened was I was serving lunch on a usual day, and one elderly person, he wasn't eating his lunch. He seemed visibly quite anxious. So what I did was I went up to him and I used effective communication, asking open-ended questions. For example, how are you? How are you feeling? How are you doing? And I ensured whilst asking these questions, I also used a really good sense of non-verbal communication. So I opened my body language, I lowered my tone, I could maintain good eye contact. And due to the way that I approached this, the patient then trusted me a lot more, explaining the problem, how we were struggling to make friends. And by explaining that, I was then managed to find a solution, so introduce them to a couple of people. And upon reflection, it really showed me when it comes to communication, the importance of not just what you say, but the way you say it, and the importance of that non-verbal sense of communication. Of course, when you're speaking to someone, one thing that they always analyze of you is the way you speak, the hand gestures you use, the body language. And by me, for example, lowering my tone and sitting at eye level to avoid a power dynamic, it built that sense of trust between me and the patient. And as a result, it then allowed me to then understand what was going on. And the reason why this is so important in a career like dentistry is because as a dentist, you always have to give patients the right to autonomy. Autonomy is the right to decide their treatment and have make that informed consent from having all the information. And the way that a patient gets all the information about a treatment is by the dentist effectively communicating, explaining the pros of a procedure, the cons, the consequences, the costs. And by a dentist effectively communicating all of this, it allows the patient to then make that informed consent, linking to GDC pillar number 3. And as a result, I saw a really good example of this on my work experience. So what happened was a young child had come in who was quite visibly anxious about the treatment. And what the dentist did was, instead of rushing into the procedure, he communicated really effectively with the child, explaining step by step what was going to happen, also giving stop signals. So explaining to the child how at any point the child can stop the procedure if he wanted to break. And by seeing this, it then allowed the child to ease up a lot more and then undergo the procedure, allowing the child linking to putting the patients first, so linking the GDC pillar number 1. So to conclude, this was a time that I really displayed good communication skills, and the things that I learned from the situation will directly be used when I become a dentist, so I can have a positive impact on the quality of care I give to patients.
Perfect, thank you. That was a very nicely structured answer. You included quite a few different points. Starting off with your volunteering, you really established your role first with a nice, concise sentence, and then like talked about the specifics of how you communicated with that patient or that elderly person. And I liked how you included what the impact of your good communication skills were. So you didn't just say I did good communication, but you said that whatever you did resulted in the man trusting you and then like opening up and then you could find a solution. And then you specifically said you reflected upon this and then you linked it to a lot of GDC principles like autonomy and things like that. So overall very long, very nice answer. I would say it's quite a little bit long, but again, in the Queen Mary thing, they will probably cut you off when it gets too long. So do continue talking. Maybe at the end, if you, like, for example, had the same question for an MMI, it's a separate university interview. What I would say is at the end, when you included another work experience example, because you've included so many examples already, I'd say that that would be like enough time for you to start expanding more on how communication is impactful in a patient care setting, rather than giving another personal experience example. Because I think up till then you had already included two, and at some point it does get like a little bit overboarding the examples. But other than that, very good answer and very nicely structured.
Yeah, so genuinely, that was, yeah, like you were saying, almost perfect answer. Um, I really like that. That's a really good way to set up your examples, like, in terms of for any of these situation kind of things. There's a situation, there's a problem that you've noticed, and how you resolved it. That's really how every single situation, like, question should go. You use that skill to resolve it, and you did that perfectly. And you went into the specifics. So you spoke about how you knowed your tone, you stayed eye to eye level, right, to change that dynamic. That was a perfect story, right? And then you came up with your result. And then again, what you did really good is you went on to straight onto talking about how what it taught you about communication. That's a really important thing. You need to say what lessons you learned. And you said upon reflection. So you highlighted to me as an interviewer, if I was an interviewer, oh, he's saying what he learned from it. And then after, which is really good, you then related it to dentistry. But yeah, that was the only part that got a bit too long. Like you didn't need to say everything. It was really good what you're saying, but you might get cut off. But in some interviews, because of course you might have different dental schools which have longer interview questions, like time for questions, that would be good. But yeah, just you don't want to put too many work experiences if you can in an answer because you don't need to. And that's when the answer starts to get slightly boring, like in a sense. I'll just say that, but really good answer.
Okay, perfect. So does anyone else, one final person maybe want to have a go? Otherwise, I'm going to move on to the model answer again.
Sorry, do you mind me quickly asking?
Yeah.
Should you fear that cutoff or not? Like, or should
No,
it
no,
just
no, definitely not. So, like, okay, what my main advice would be going into your interview, be prepared to be cut off and don't let it fumble you or like cut trip you up when you're answering. So just keep that level of confidence at the start. If you do get cut off, take it with the mindset that they've heard enough, not that they think you're going on about rubbish and they don't want to hear anymore. It's that they've heard enough and they're happy to move on to the next question. So don't be worried about that because it's just for the sake of time and like keeping everyone's interviews the same length.
Okay, thank you.
Anyone else want to have a go?
Well, again, sorry, it's not. Can I ask a question?
Yeah, sure.
So about getting cut off. So you said that's all right, not to give a conclusion. You should just keep saying points.
I mean, if you feel like you've have like reached a nice point in your answer, do go on to the conclusion, but at a point you won't get like
Yeah.
masses of time to like keep on expanding, so you will find a natural like rounding off to your answer. I'm just saying that some people are answering like with 5 6 minute long answers, and that's not realistic for this kind of interview. So it's like 1 or 2 minute answers are like the max you're gonna get. It really does depend on each interviewer though as well, because I've heard of some that do like cut you off after like 60 seconds, and then some give you more time, but it's really nothing to be like afraid of or anything. It's just when they've felt like they've had enough.
Okay, that makes more sense. Thank you.
Okay, thank you. So no one's really volunteered to have a go at the question again.
Is
So I
it,
am
sorry, is it okay if I ask a question as well?
yeah.
I was asking, is it okay to ask for a minute to think when you get asked the question, or is it too time pressure to do that?
I'd say that if you genuinely do need a minute, then do take it. But at the same time, because it's a very short interview, try your best to like start as quick as possible,
Yeah.
just because of the style of interview you have.
A
It's very
minute is
different when
long.
you, yeah,
Like, a minute is very long. Like,
yeah.
so like maybe 5 seconds. Just give me a second to think and then go into it. A minute, you're not going to get a minute. They'll literally say no.
Like, to put into perspective, this call has been going for 50 minutes now. That's like 2.5 people's interviews. So can you imagine just how much time you're actually going to have in that? It's very, very little. So do try to go straight into it. A trick that I used to do, if I needed that extra couple seconds, I'd repeat the question as part of my answer. So if, for example, I got this question, tell me about a good time you displayed good communication skills, I'd start off by saying, a time where I displayed good communication skills was, and that gives you that few seconds to think. I know it's not that much, but it's better than nothing. So just a little trick that I used to use. I hope that answered your question.
Yeah,
I'm I'm going to move on to the model answer, but I am going to give some time to ask questions at the end. So, like, if anyone does have any burning questions, I will give you a chance after this, because this is the last question we're going through. So again, I've got like rough summary of the model answer on the board. I just need to get up the answer. Give me 2 seconds. So, what was the question again? Tell me about a time you displayed good communication skills. So a time where I displayed good communication skills was through my private tutoring work, where I had to communicate clearly and effectively with all sorts of students and parents. I had to implement specific techniques, such as active listening, allowing each student to open up about their academic concerns and anxieties, which helped them feel comfortable and supported. I also learnt the importance of asking follow-up questions, as I would often find that some students didn't fully grasp a concept the first time I explained it. By implementing regular follow-up questions, it gave students the opportunity to ask for further support. It also helped me further improve my communication techniques by allowing me to recognize when a specific teaching style wasn't as beneficial to a certain student's needs, giving me a chance to adapt the resources and the methods I was using. So, for example, sometimes some students would prefer visual approaches to learning, where I would show them diagrams and pictures, whereas some others would prefer like actual text and going through questions and information like that. From my work experience and research, I understand how important good communication is in dentistry. A dentist must be able to communicate effectively with the patient, not only when trying to diagnose them by asking about their symptoms, but also to obtain valid and informed consent when proceeding with a certain treatment. This respects the patient's autonomy to make decisions about their own body, upholding GDC principles. I believe my own experience working on communication skills during tutoring has therefore prepared me to utilize good communication techniques as a dentist and therefore provide the best level of care and standard of care possible to my patients. So I hope that answer was beneficial to you guys and you've got a better understanding of the kind of things that they're looking for when you get asked a skill question like this. This advice that we've been telling you and feedback for each question, it applies also to other skill questions such as like, tell me a time you showed good leadership skills, or maybe a time that you showed empathy, or a time you showed resilience. So all of these types of skill questions, you need to focus on the same marking points, being specific, showing them what you actually did in that situation and reflecting upon it and how it actually impacted you and what you think about the way you dealt with that situation. And then, of course, all of these questions need a link to dentistry at the end, and try to link it to the quality of patient care that they're getting, because at the end of the day, the patient getting the right treatment and good quality treatment and a safe treatment is the highest priority in all of these kind of situations. So that really does end off what we had. Now I can see there's quite a few messages in the chat. So if anyone does have any questions, you can say them out loud or put them in the chat. Someone's asking about a recording. I don't think this is going to be recorded. Sorry. Um, uh, Tell me about a time you showed questions. Should we also mention a scenario where we saw the dentist using the skill during work experience? You can, but don't, because you've already given like a lengthy like example of how you did it with your own skills. So the question was asking if should you also mention where you saw the dentist using the skill in your work experience. You don't need to include it as a big fat point after your first point when you're talking about how you utilize that skill. Rather, what I would do is like I'd add it as like a mini sentence starter when I'm talking about the importance in dentistry. So, like, say during my work experience as well, it reinforced my understanding of how communication is important when a patient is dealing, when a dentist is dealing with a patient and trying to make sure that they get the best level of care possible. For the article, will they ask multiple specific questions or will they ask one open-ended question? And will they allow you to talk up to 10 minutes? So with the article, they do ask only a handful of questions just because of time. So I maximum maybe 4 or 5. Don't take this like as solid, hard, set in stone information though. It really does depend on the length of your answers. It's not one single open-ended answer question because they do ask quite a couple of them afterwards because you're not going to answer for 10 minutes for one question. If they ask you follow-up questions if you finish earlier, yeah, they would ask you follow-up questions. What I say about Queen Mary's is that the interview is more of a conversational style compared to other interviews where they have set like 5, 6 questions that they're definitely going to ask and they've got no follow-up ones. This one felt like much more like a conversation, so he was asking follow-ups to what I was talking about. For my Y-Barts, my answer is way more than 3 points. Would it be fine just to keep on going until they stop? Yeah, just keep going until they stop, pretty much. Also, I've heard say your points briefly at the start, so if they cut you off, they know what you were going to say. How do you do that for an ethical skills question where there is okay. For the ethical skills questions, I don't think you necessarily need to introduce every single thing you're going to talk about at the start, because that is kind of a little bit of a waste of time. I think for these kind of questions, you don't need to introduce it in as much depth. Just quickly get to the point and start explaining how you used each skill in each context. Like, the example answers that people have been saying in this, especially one of the ones closer to the end, where we got given like quite a few different examples. You can see how each person, they didn't really give like a proper introductory sentence where they said, today I'm going to be talking about XYZ. They just went straight into it. And I think that's the best way to approach these kind of questions, the ethical and skills ones. Does Queen Mary ask ethical scenarios? Really depends on each interviewer. You can't take it as a set in stone yes or no. Can we cover potential challenges a dentist may face and how we deal with them? So what do you mean like now? As in cover that question? Arman, you put, can we cover potential challenges the dentist may face?
Yeah, I meant like right now, if you give like examples of problems that could be and like how would a dentist solve them, so we can have
Yeah.
like a feedback of ideas if they ask that.
I can give 1 or 2 really brief examples just for the sake of time. The main one that I would probably answer with is stress and dealing with patients that aren't like quite compliant, or maybe they don't really want to get the treatment from you, or they're maybe disrespectful. So you'd mainly support that up by saying that you'd implement better communication techniques. But in this kind of answer, it's important that you say, I recognize that this is something that I'm gonna face, and it's not something that I can just fix straight up. I can't just magically make every single person really kind and polite to dentists. You need to say you've got a support system in place, you've got coping techniques on how you would cope with that kind of stressful situation. And say, for example, maybe you could link it to having a support system at home. You'd speak to someone at home about stressful situations you encountered. Or maybe you could talk about a activity you do that's quite mindful that helps you relieve your stress. So that's just briefly how I would answer that one.
Okay, thank you.
It's okay. Can you please recap why QMUL, because I joined a little bit late. I'm not sure if we have enough time for that. Because it was quite like a long answer. But I think we can see if we can send the PowerPoint out. How many questions did you get asked in the second part of the interview? It really does range. It depends on each person. It depends on each interviewer and how long your answers are. How should we analyze the article to prepare best for any questions they could ask? So with the article, if you're stuck on thinking of questions, get put into ChatGPT and ask it to generate some. It doesn't need to be overly complex questions. If there is a theme to the article, say for example, last year it was fluoride. That's a very big hot topic. Obviously, go in and research fluoride and look into the debate about it and make sure you understand in depth that hot topic. So the same would apply for whatever this year's article is about. If they ask what should questions should we ask at the end of the interview? So if the interviewer asks if you have any questions, if you genuinely have one about the university, go for it. What I did in my one, because I got asked that, I'm not the kind of person that would be like put on the spot and be able to ask like an in-depth question. So something my MedSoc tutor told me to do at school was just say that the student ambassadors that I spoke to before and on open days were really amazing and they answered all the questions that I had. So it made me come across as more passionate, but it also like didn't make me have to directly ask an awkward question at that point. But if you genuinely have a question about the university, maybe say, what do you enjoy the most about teaching at this uni? Or something like that. It doesn't need to be that long. Again, people keep asking about the number of questions you'll get for each section of the interview. It really does range. How have they changed the curriculum? It's more to do with earlier clinical interaction with patients, not treating them, just giving them oral health advice and being able to shadow appointments. And also they have cut down a teeny bit of content in first year. So before it was quite like a big range of content you were learning. And like, you know, what you hear people say when they join dental school, why are they learning about like some random bone in your arms, for example. Why are you learning about the whole body? And they took on quite a bit of student feedback about this kind of stuff, and that's why the like refined curriculum came into place. So it's just making the information we're learning directly dentistry related from day one and showing us clinical applications of it in lectures as well. Are we asked about article first? Yeah, you're asked about the article first, then the general questions. Personal statements, it depends on the interviewer. Be prepared to have the entire personal statement cut apart, because that's what happened to me. But there's some people who don't even get a single question asked. So do like be prepared for both. What's teaching styles at your university? I'm not sure if it's there's the PBL and SBL, but I'm not sure which one it is. You're gonna have to Google that. But clinical stuff, we have basic clinical teaching in first year as well, not just second year. Obviously, we're not doing any treatments this early on, but we've got haptics labs. In your Queen Mary answer, you can talk about the fact that they've got the highest amount of haptic seats across the UK, or I think across Europe, I'm not sure. But that is like a valid point to bring up because it helps your learning journey. What's your timetable like for the first 3 years? I'm not sure about second and third year, but my one at the moment, it really depends on the week as it changes like from week to week, even just based on how many clinical hours I have. But at the start of the year, you get a Google Calendar, so you can look for the whole year, every single day, what you've got, and you can plan ahead and stuff. But some weeks I'm in like 3 or 4 days. It depends because they try to put all the lectures on the same day, which some people like, some people don't. But you often find that all your lectures are on the same day, and then you might get 1 or 2 days off during the week. But it's definitely not as heavy load in first year as later on from what we've heard from the older years, because you obviously have to come do the treatments almost every day. PBL. I'm not too well versed about PBL versus SBL because I don't know which one Queen Mary does, but you can definitely find that online. What type of questions about my personal statement? So it depends on your personal statement because obviously we're gonna have different things in ours. But like he went through the different like things I included in there in terms of like I did tutoring, for example. He asked, tell me a little bit more about this. Just general, just be prepared to use those as talking points. If it helps, you know your skill answers when you're talking about leadership, teamwork, communication, revolve those around examples you've included in your personal statement because you will be very used to talking about them then, and then that will help you. So, like, because I did that personally, it made me prepared to talk about my personal statement in an interview, even though I wasn't like very much expecting them to, because obviously it depends on each interviewer. You might not get asked any, so definitely revolve your answers around those points. Is there a lot of lecture-based learning? In first year, yes. Majority of our learning is lecture-based. We have a little bit of clinical work, but it's not too like over the top. So we like learn how to set up each bay, learn how to do PPE. We did a bit of haptics, but it wasn't like over the top, like doing treatments. It was just messing around with it. Um, can't think of anything else we've done clinical based, but that being said, I'm only just starting second term, so obviously we haven't done like as much as you'd expect. Support systems that they have. Dental families. Yeah, they do have dental families. It's called Bart's families. So you get assigned a Bart's parent when you join in first year. So your Bart's mums or Bart's dads, and then you get siblings and then cousins and stuff. That was really nice when we joined because it meant that you had someone to talk to because you were added to the groups before uni even started. So I already knew some people. And the what I'd say is the older year groups are very, very like open with giving advice. So it's a very like nice atmosphere at the university because they are very like proactive and they like to get involved with the younger year groups giving advice. And they hold like a lot of revision study sessions for us as well. We had one just before our last exam where they went through lectures that we all voted on and said that they were the hardest we have done and we wanted them to go through them a little bit further. So I say that that was really helpful. Um, Student support systems, they've got like your average student support systems, but like the reason why people appreciate them more is because they're very accessible and they do a lot of talks throughout the year and then they've got lots of events going on. But even if you don't have like specific examples, you could just say that people have had positive experiences from the student support systems. I've already talked about my timetable. Personal statement, do you mean they want you to mention things from your personal statement in your answer? Or they may ask you questions based on your personal statement? They may ask you questions based on your personal statement. So like be prepared for that in the second half of your interview. Yeah. I think I've got through all the questions that are in the chat anymore at the moment. If anyone has any desperate ones, you can send them now. But I think the talk is basically over now because we've been through pretty much everything that was on the agenda. If anyone does want to book a mock interview with specific advice to Queen Mary or any other universities, do get in touch because we can definitely arrange that for you. And the people who have had these interview mocks with us already have had really positive feedback, and you can check that online as well. Yeah. Do you want to add anything? No?
No, that's everything.
Okay, so
Yeah. Thank you all guys for coming on.
yeah. Someone just asked how would you get in touch with the MyUCAT platform? I'm assuming they've got something on the website, right? Yeah. So you could probably access it through the MyUCAT website. And then whoever you get in touch with from there, they'll
All the
link you with the
Instagram
right
as well.
student.
Yeah, you can try the Instagram as well if you don't get any responses.
Yeah. So I think that's all the questions. Oh, there's one more. No, someone's asking for the numbers. Okay, so I hope that was helpful for everyone. Do please book some mock interviews if you want further advice and personalized feedback. But I hope that was helpful and good luck for all of your interviews.